To the best of our understanding of COVID, it's not so much that being pregnant puts you at a higher risk of contracting it. It's more so that if you're pregnant and you do contract it, your risks are higher to have complications. Pregnant women should take the same preventative measures as non-pregnant women. We're talking about hand hygiene, wearing masks, and social distancing. So if a pregnant patient is to contract COVID, ultimately the treatment is the same. The treatment is supportive. We have to make sure that we treat fevers. Fevers can be problematic for pregnancies, for the babies, but ultimately we have the same goals if there's an admission to make sure that mom is getting oxygenated appropriately, we keep blood pressure at an appropriate level, and all the treatments that we have for COVID would be acceptable in pregnant women. Our best understanding is that COVID is not transmitted through the placenta to the fetus, but there are cases of newborns having COVID, and there's a concern that that is more so from transmission from droplets from the affected mother. So if a mother does have COVID and just delivered a baby or has a newborn at home, again, we go back to those same precautions of wearing a mask. It's obviously much harder to social distance if you are taking care of a newborn. So mask and hand hygiene would be the best ways to prevent transmission. I think the big takeaways that we want moms to understand is that the absolute risk of contracting COVID is low, and we can keep it low by going through the social distancing, hand washing, mask wearing. And if you were to get COVID, your most likely course would not be a hospital admission or a ventilator. The risks are higher if you're pregnant, but most pregnant women will recover without long-term issues. The Society for Maternal Fetal Medicine published 3 recommendations around pregnancy and the COVID vaccine. And the American College of OBGYN published a big statement on their own. And the basic takeaway from those statements is that pregnant patients should be offered the COVID vaccine. And those who do not want to take it should be supported in their decision. There's not one right or one wrong on what a patient should do for herself. So when one is making the decision on should I or should I not get vaccinated, it's what we call a shared decision-making model. And that's done with your physician. And you have to take into account things like the level of activity of the virus in your community, the potential efficacy of the vaccine, the risk and potential severity of maternal disease, including effects on the newborn, and safety in pregnancy of the vaccine. Some people see the statement that the vaccine is not recommended in pregnancy and assume that means it's not safe. And the reason it's not recommended is because there has not been enough data or studies done on pregnant women. The CDC does have a registry for any pregnant patient or lactating patient who chooses to get the vaccine, who would like to provide the CDC with their own pregnancy information so that we can learn more about the safety of the vaccine. It does not mean that it's unsafe for pregnant women. When we talk about vaccines in pregnancy, we're typically thinking of 2 types of vaccines. We're usually looking at vaccines that are just viral particles that the body then senses and makes an immunity against, so that if you are exposed, you end up making a quick response and don't have a very severe course. That's your typical flu vaccine. The other type we talk about is what we call live attenuated vaccine, and that's when we've sort of dummied down the infectivity of the virus itself. Those we typically don't give in pregnancy, though in cases where it's been reported they've been given, we don't find that there's been long-term issues or problems as far as fetal growth or development. The Pfizer vaccine is a newer technology utilizing what they call mRNA or messenger RNA. And essentially what they've done is they've looked at the genetic code of the coronavirus for the surface markers, the same markers that your body would build an immune response to. And they've taken that and turned it into this messenger RNA, which essentially codes for those proteins. When you get the vaccine, that messenger RNA goes into your immune cells so that your immune cells can create the protein and present it to other immune cells and train those immune cells to look for those viral particles and make antibodies towards those viral particles. It's likely due to this aspect of the technology as to why the efficacy is around 95% as opposed to other vaccines which are lower.